www.healthcmi.com. Acupuncture Continuing Education Online. Today, acupuncture and herbs reverse facial paralysis finding. Let's take a look. Acupuncture and the external application of herbal medicine provide facial paralysis relief. Changzhou Hospital of Traditional Chinese Medicine researchers demonstrate that acupuncture combined with herbal steaming and washing provides effective relief for patients with peripheral facial nerve palsy. They compared two protocols. One group had acupuncture plus the external herbs. Another group did acupuncture plus internal herbs. Both groups did better. They took the House-Brackman scores and symptom scores and found that the external washing and steaming plus acupuncture had about a 96% total effective rate, where the internal herbs plus acupuncture had an 84% total effective rate. Acupuncture is well regarded within the medical community for the treatment of things like Bell's palsy, which is one type of facial nerve palsy. So typically, these palsies are caused by viral infections, post-surgical complications, trauma, diabetes, bacterial infections, tumors, adverse effects associated from medications, and immune system disorders. Again, there's different parts of the face are paralyzed. This can cause a lot of lifestyle problems with speaking, with closing the eyes and dry eyes. Of course, it's unsightly, so people feel ashamed sometimes to go out in public. There's some issues also just in trying to communicate with people because there's drooling, and sometimes communication becomes extremely hampered, not to mention eyesight problems and driving a car or something like this with the eye not being able to blink. So there are a lot of issues associated with it. Now, if it's simple Bell's palsy, basically it's considered idiopathic, meaning, as we say in Chinese medicine, Bujia Dao, but they say idiopathic in Chinese medicine. They don't really know the true etiology necessarily why facial nerve number 7 in this case would be inflamed. Nonetheless, I think from a biomedical perspective, they might want to give you acyclovir if you had it in time. But after 24, 48 hours, some of the studies suggest that it might be too late to give that antiviral, if indeed the virus is causing the problem to begin with. And sometimes steroids are used, but acupuncture is great and just works well. And here they're adding herbal medicine. Now, this research proves that, but this is something that's just standard in the clinic. And even with a lot of what we call Western or biomedical texts, it is recommended to refer to an acupuncturist. So this is certainly a forte of the field of acupuncture and is not something to be overlooked. And I'll tell you why. For some forms of facial paralysis, including some forms of Bell's palsy, they will resolve almost completely, if not 100% on their own. It's true. However, some cases will resolve 90% or 80%. But if you do the acupuncture and you do the herbs, you're going to have a much higher efficacy rate of 100% recovery. And that's the key. You want 100%. You don't want 90%. You want 80%. You don't want 50%. So there's like stage 1 through 5. I've treated in my own clinic as a licensed acupuncturist for 30 years. Many cases of FNP, facial nerve palsy, and also, of course, specifically Bell's palsy. The majority of the people recover basically 100%. I've treated some who are taking the acyclovir, some who are taking the steroids, some who got stuck and come into me a year later, didn't get any result, and we inch along and try to get results because the longer you go, it's much slower result. Some people, surprisingly, even a year or two later, get great result quickly, but usually it's slower and they have to come in for quite a while if it's like a category 4 or 5 level. So those people can see results, but it's very tough going. If it's only a category 2 or 3 grade, then sometimes it's a lot easier. Nonetheless, their treatment protocol would be lacking if they didn't have the advantage of acupuncture. And in this case, they're showing the herbal medicine. They give you the exact herbs. They give you the exact acupuncture points. If you go to healthcmi.com, click on news and type in acupuncture and herbs reverse facial paralysis finding and search, you'll find that this particular article gives exact clinical details of it, how this was achieved. Types of needles used, depth of insertion, herbs used, dosages, everything, even how the herbal steaming was done. So really a great article, some great research. I want people to take a look at it. This is simply something that acupuncture is well known within a lot of medical circles for taking care of very effectively, but I'm not sure the general population and even a lot of doctors are aware that this is considered one of the most important and effective protocols for the treatment of facial paralysis. There's a lot of myths around acupuncture. You know, some people are still on the page of does it work, does it not work, you know. And this is really buying into a lot of cultural, I'm not going to say xenophobia, but ethnocentrism, that's the word. Because even the American College of Physicians recommends acupuncture, let's say for back pain, for example. In fact, in the U.S. medical system, they have acupuncture for back pain as part of the Medicare system, as long as the MD bills for it, so the acupuncturist can perform it and get reimbursed. So there already is inclusion of acupuncture in the medical system. In fact, most major cancer centers, the overwhelming majority of them in the United States, Memorial Sloan Kettering, etc., include acupuncture as part of their cancer care protocols because acupuncture is incredibly effective for the treatment of nausea due to chemotherapy. It can be instant. The needling of PC6 Naguan, a great acupuncture point for that, and many other things like, for example, relieving pain in cancer patients. So it's a humanitarian type of protocol to really help people either live longer or have just the remaining of their life be very peaceful without as much pain and suffering, and to sleep better and have a little more peace of mind. So acupuncture is already part of the system, and there is kind of a mythology or a romanticism that keeps it at arm's length. But unfortunately, this is a misunderstanding because there's so much research. If you go to the news department at healthcmi.com, you'll see research from all the major institutions globally, including the United States at Stanford, University of Pennsylvania, University of Maryland, Harvard University, etc. For example, recently, I know Harvard came out with a piece of research, which I'm going to pull up on the fly during this podcast and see if I can bring it up right away. Yes, here it is. It was published August 19, 2020, Acupuncture Anti-Inflammatory Effect Discovery. And that article featured research from Harvard Medical School neuroscientists, and they concluded acupuncture regulates inflammation in response to bacterial infections. So better response if you have an infection, if you get acupuncture, and that's right out of Harvard Medical School. Why I mention that is because a lot of the research out of China does not always get the same respect in Canada, the United States, and Mexico, here in North America. But in fact, plenty of institutions in North America have done very high quality levels of research showing acupuncture works. That's one example. So if you went to healthcmi.com and clicked on news, you could find the article Acupuncture Anti-Inflammatory Effect Discovery and see that from Harvard Medical School. In this case, this one on facial paralysis, again, while it's a great study and it shows you what points used, I love the point choices, by the way. They gallbladder 20, liver 3, GV 20, large intestine 4, GV 16, Fengchi, Taichung, Baihui, Hegu, Fengfu, and some secondary points were added as well. And it specifies all of that and the types of needle used. While it is a good study, again, it's not unique. There's simply hundreds, if not thousands, of recent studies showing that acupuncture is effective for facial paralysis. Many types. We have the post-stroke syndrome, post-polio syndrome type of work where we do central nervous system work, much more difficult and more advanced work, often involving scalp acupuncture, and then peripheral nerve stuff like this, especially with facial nerve 7, with FMP, which is peripheral facial nerve palsy, and of course Bell's palsy, which is very common. So this research is certainly not unique in that respect. I'd like to say it's a discovery, but I think this has been discovered over and over again. Things are not always as we think, and I would say with Chinese medicine to think, oh, it's mysteries of the East and all this kind of stuff. Well, not so mysterious and scientifically proven. I just wanted to really highlight that because sometimes we put things in a historical perspective and we don't realize that acupuncture has actually been part of mainstream medicine in a greater way than we realize, and our perspectives may have been skewed by different historical interests. And there are political moneyed interests that do keep acupuncture at arm's length, but for the most part, for facial paralysis, it's really something that needs to become standard protocol. Why? Because it's cost effective, it's safe and effective. There's simply no reason to keep it at arm's length because it can provide so much relief to people. And again, it's not just visual. It is, in fact, something that can impede communication between people. So it's something that's hugely important. And the dry eye is really, if someone can't blink, it's really quite terrible. So this is something that can really provide a lot of relief from suffering. So I encourage people to take a look at this article. Go to HealthCMI, click on news, and take a look. Thank you for listening. I'm Adam White, licensed acupuncturist. www.healthcmi.com.